Welcome back to the deep dive. Today we are tackling something massive. And I really don't use that word lightly. We are looking at what many call a silent epidemic.
It really is. It's the kind of thing that's just humming in the background of almost everyone's life and, often without them even knowing it.
Exactly. We tend to talk about health issues as these separate, distinct problems. You have your heart disease people, your brain health people, your weight loss people. But today, we're going to pull back the curtain and look at the root cause, the one thing that actually connects type 2 diabetes, obesity, Alzheimer's, heart disease, even things like infertility.
Like the common soil that all these different weeds are growing out of.
That's a great way to put it. And to help us dig into this, we are looking at a really fantastic conversation between Dr. Rhonda Patrick and Dr. Ben Bikman. Now, for those who don't know, Dr. Bikman is a professor of cell biology. His specialty is metabolic disorders. He's essentially a detective for why our bodies, stop processing energy the right way.
And what makes this discussion so valuable, I think, is that they don't just stay in the lab with a theory. They get really practical. They talk about what you can actually do. So our mission today is to break down exactly what insulin resistance is, why your doctor probably misses it, and then the specific evidence-based lifestyle changes. We're talking diet, exercise, sleep. They can actually reverse it.
Right. And for everyone listening, we want to make a special point here, especially if English isn't your first language or if you find that medical terms usually just make your eyes glaze over. We are going to keep this crystal clear. We're not going to use jargon without explaining it. We want this to be precise, accessible, and above all, actionable.
The goal here is clarity. We really want you to walk away from this feeling like you understand exactly how your body works on this front.
So let's start with an analogy that Dr. Bikman uses. I absolutely loved it. It just sets the stage so perfectly. He talks about a sick tree.
Right. So he says to imagine a tree in your garden that's, withering. The leaves are turning brown, the branches are snapping off. Maybe you're seeing some fungus on the bark.
Okay, so a very unhealthy tree.
A very unhealthy tree.
Yeah.
And what he says is that in modern medicine, we tend to look at the branches individually.
We look at the symptoms one by one.
Exactly. We say, oh, look at this branch. It represents high blood pressure. Let's prescribe something for that branch. Or this branch over here, well, that looks like memory loss, maybe early Alzheimer's. Let's treat that. Or, this branch is infertility.
We're basically just trimming the dead branches, maybe painting the leaves green to make it look a little better from the outside.
Precisely. We are managing the symptoms. But Dr. Bikman's whole argument is that we are completely ignoring the trunk. The trunk is the common connection for all of it. And in this analogy, the trunk is insulin resistance.
Ah, okay.
His point is, if you cut the tree at the trunk, you stop feeding all those diseases at once. Or, to put it more positively, if you heal the trunk, the branches start to take care of themselves.
So we need to stop staring at the brown leaves and start looking at the trunk. We need to really understand insulin resistance. Let's unpack this then. What is the fundamental problem with how we view blood sugar and insulin right now? Because I feel like everyone, and I mean everyone, talks about glucose. How's your blood sugar? That's the only question.
That is what Dr. Bikman calls the glucose-centric paradigm. And it is absolutely the dominant view in medicine today. You go to the doctor, you get your annual checkup, and they measure your fasting glucose.
And if it's normal, say under 100, you get a pat on the back, you go home thinking, I'm healthy.
Correct. But here is the danger, and it is a massive, massive blind spot in our system. You can have perfectly normal blood sugar, but have dangerously high insulin levels at the same time.
Okay, wait, let's pause there because that sounds contradictory. How is that even possible? I always thought insulin and glucose move together. If one is high, the other has to be high, right?
They are related, but think of it like a war. Dr. Bikman uses this great analogy of a Cold War. Glucose is the enemy that the body is trying to keep in check. You absolutely do not want high glucose floating around. It's toxic, it damages tissues. Insulin is the army you send to fight that enemy.
Okay, I like this. So glucose is the potential threat. Insulin is our defense force.
Right. And in the early stages of insulin resistance, and listen, this can last for years, maybe even a decade, your body is struggling. Your cells aren't listening to the normal amount of insulin. So the pancreas, which makes insulin, it just works over time. It pumps out more and more and more insulin. It's a troop surge to keep that glucose enemy suppressed.
So the doctor looks at the battlefield, which is the blood test, and sees that glucose levels are low and stable. The battlefield looks peaceful.
It looks peaceful. But what they're missing is the massive, exhausted army of insulin that was required to maintain that peace. The war is raging, but the casualties, which would be high blood sugar, haven't shown up yet. By the time your glucose actually rises and you get that diagnosis of type 2 diabetes, you've likely had sky-high insulin for a very, very long time.
That is genuinely terrifying. It means you could be considered healthy on paper, but underneath the surface, your metabolic system is just drowning in insulin.
Precisely. You are fighting a hidden war, and the consequence of ignoring this is severe. Because think about it, if a doctor is only looking at glucose, what happens when a patient finally becomes diabetic and their glucose is high? What's the standard treatment?
Well, it's usually medication to lower the blood sugar.
Or they give them more insulin.
Exactly. They treat the high glucose by prescribing more insulin. But based on what we just said, if high insulin, what's called hyperinsulinemia, is actually the driver of the disease, the thing making you sick and fat in the first place, then giving more insulin is like throwing gasoline on a fire. Wow. So you're treating the symptom, the high glucose, by making the root cause, the high insulin, even worse.
And Dr. Bikman points this out very clearly. This approach often makes patients fatter and sicker in the long run, even if their blood sugar numbers look better on a chart. It can actually accelerate the mortality associated with the disease. You're fixing the number, but you're not fixing the patient.
Okay, so this is a huge problem. If the standard blood test misses this metabolic Cold War, how do we actually know if we're winning or losing? How can someone listening right now know if they have insulin resistance?
There are three main ways, and they're all pretty accessible. The first one is the most direct. You have to ask your doctor for a fasting insulin test.
A fasting insulin test? Is that common? Will my doctor just do that automatically as part of a physical?
It absolutely should be, but it isn't. It's not standard of care in most places yet.
No.
You almost always have to request it specifically, and you want that number to be low. Dr. Bikman suggests aiming for 6 microunits per milliliter or less.
6 or less. Got it.
Yes. If your number comes back in the high teens or in the 20s, that is a huge red flag. It means your pancreas is basically shouting to get the job done when it should only have to whisper.
Okay, so ask for a fasting insulin test, aim for 6 or less. What's the second way?
A continuous glucose monitor or a CGM. These are becoming incredibly popular. You've probably seen people wearing these little white patches on the back of their arms.
Oh yeah, I see them everywhere now. They track your blood sugar 24/7 and send it to your phone.
Exactly. But here's the key. Don't just look at your fasting number in the morning. Dr. Bikman says the real value is in what he calls dynamic glucose. You need to watch what happens after you eat.
It's like a stress test for your metabolism.
That's a perfect way to describe it. If you eat a carb-heavy meal, let's say 2 slices of bread or a bowl of rice or even a banana, how fast does your blood sugar come back down to your baseline? If it takes more than 2 hours to get back to normal, that's a strong indicator that your insulin isn't working efficiently.
So if you eat lunch at noon, and by 2:30 or 3:00 p.m. your sugar is still elevated, that's a problem. Your body is struggling to clear the fuel from your system.
Yes. But there's a third way, and this one is my favorite because it requires no needles, no doctors, and no technology. Dr. Bikman calls the skin a window to the metabolic soul.
I love that phrase, but it also sounds a little ominous. What exactly are we looking for in our skin?
Well, remember, insulin is an anabolic hormone. That means it makes things grow. And when you have way too much of it circulating all the time, it starts to affect your skin cells. You're looking for 2 very specific signs, usually around the neck or in the armpits. The first is a condition called acanthosis nigricans.
Okay, that's a mouthful. Acanthosis nigricans. Break that down for us. What does it actually look like?
It shows up as a darkening of the skin, often in the folds of the neck. Some people might think it's just a dirt stain that won't wash off. But more than the color, you have to look at the texture. He says it looks like crinkled tissue paper. It gets this rough, almost velvety feel to it.
Okay, so dark, crinkled, velvety skin, especially on the neck. What's the second sign?
Skin tags.
Skin tags. Really? I think a lot of people just assume those are a normal part of getting older.
They're very common, yes, but they are not just random. Dr. Bikman describes them as little mushroom stalks of skin. If you start seeing a bunch of skin tags pop up around your neck or in your armpits, that is a definitive sign of high insulin. It is your body's growth pathways going into overdrive because they're being constantly stimulated.
That is absolutely wild. So before you even go to the doctor, before you get any tests, you can just look in the mirror. And if you see those tags or that velvety texture, your body is basically sending you a direct message.
It is shouting at you. It is saying, I have too much insulin.
Okay, so we know what it is and how to spot it. but I really want to understand how it happens. This isn't something that just happens overnight, right?
No, not at all. And this is where Dr. Bikman's work adds a lot of nuance that you don't usually hear. He divides insulin resistance into two distinct types: fast and slow.
Fast and slow. Okay, let's start with fast. That sounds like something acute, something that happens immediately.
It is. Fast insulin resistance is actually a temporary and often protective mechanism. It happens in response to three main things: stress, inflammation, and this is the ironic part, too much insulin itself.
Okay, stress. So we're talking about cortisol and adrenaline.
Cortisol and epinephrine, which is adrenaline. Think about it from an evolutionary standpoint. If a bear's chasing you, your body needs energy available right now. It dumps glucose into your blood for your muscles to use. And to make sure that glucose stays in the blood and doesn't get stored away in your fat cells, your body becomes temporarily insulin resistant.
So the stress hormones basically block insulin's effect so that the fuel stays available for the fight or flight response.
Exactly. It's prioritizing your immediate survival. And the very same thing happens with inflammation. If you're sick, so you get a cold or the flu, your body becomes insulin resistant. It does this to keep energy readily available for your immune system, which uses a massive amount of glucose when it's fighting off an infection.
That explains why people with diabetes often see their blood sugar go completely haywire when they get sick.
Right. A very clever, short-term survival mechanism. But then there's the slow type.
This sounds like the chronic condition most people are worried about, the one that doesn't just go away.
This is the progressive type that eventually leads to type 2 diabetes. And Dr. Bikman has a very specific, evidence-based theory here that he's very passionate about. It starts in the fat cells.
The fat cells first. Not the liver, not the muscles. I feel like I always hear about those.
He argues, very convincingly, that it begins in our adipose tissue, our fat. And to understand this, we have to understand how we store fat. There are two ways our body can get fatter. You can either make more fat cells, or you can make your existing fat cells bigger.
Okay, so more cells versus bigger cells. Is one of those paths better than the other?
Oh, definitely. Making more fat cells, the technical term is hyperplasia, is actually the healthy way to store fat. You end up with lots of small, happy, insulin-sensitive fat cells. And he notes that women are generally better at this than men, thanks to estrogen.
So having lots of small containers for energy is much better than trying to overstuff a few big ones.
Precisely. The dangerous path is hypertrophy. That's making the existing fat cells bigger and bigger. He wants you to think of a single fat cell like a balloon.
Okay, I'm visualizing a balloon.
You can only blow up a balloon so much before it gets really tight and strained. It reaches a physical limit. If you keep trying to force more air, or in this case more energy into it, it's going to pop. So as a defense mechanism, the fat cell becomes insulin resistant. It essentially slams the door shut and says, "Stop. I am full. I cannot take any more energy, so I'm not listening to you, insulin."
It's locking the door to save itself from literally bursting.
Exactly. But because that door is now locked, the fat that should be stored there has nowhere to go. It spills over back into the bloodstream.
And that's what we hear about as free fatty acids floating around.
That's right. And because this fat can't get into the proper storage tissue, the fat tissue, it starts getting deposited in places it should never be. This is called ectopic fat. It gets stored in the liver, which leads to fatty liver disease. It gets stored in and around the pancreas. It gets stored in the muscle.
So the fat cell gets full, locks its own door, and then the excess fat ends up clogging up the liver and muscles instead.
And this is where the mechanism gets really specific and fascinating. It's not just the fat itself, the triglycerides, that clogs things up. Dr. Bikman's research highlights a very specific type of lipid molecule called ceramides.
Ceramides, I feel like I've seen that word on skin creams. With ceramides for healthy skin?
You absolutely have, and for the structure of your skin, they're great. But inside a muscle or liver cell, they are big trouble. When you have high insulin and high inflammation, your body starts overproducing these ceramides. And these ceramide molecules act like a signal jammer. They physically get in the way and block the insulin signal inside the cell.
So even if insulin is knocking on the door of the muscle cell, the ceramide is inside holding the lock shut. The message just can't get through.
That is a perfect way to put it. It stops the signal dead in its tracks. So to just quickly summarize that whole process, the fat cells grow too big, hypertrophy. They become insulin resistant to protect themselves. They spill fatty acids into the blood. And this leads to ectopic fat and the production of ceramides in other organs, which then spreads the insulin resistance to the rest of the body.
That is such a clear and powerful picture. It really shifts the blame from this vague idea of you're just eating too much to something much more specific. Your energy storage system is broken.
It's a failure of storage.
Okay, so let's talk about what breaks the storage system in the first place. We have to talk about diet. This is usually where all the arguments start. Low carb, low fat, keto, vegan. What is the actual driver here, according to Dr. Bikman's work?
According to the source material we're looking at, it really all boils down to the carbohydrate insulin model of obesity and disease.
And what does that model state, in simple terms?
It states that insulin is the absolute gatekeeper of fat storage. You basically cannot store body fat without having elevated insulin levels.
That is a very bold statement. Cannot store fat without elevated insulin.
It is, but he uses type 1 diabetics as the ultimate proof. People with untreated type 1 diabetes produce zero insulin. They can eat 10,000 calories a day, just massive amounts of food, and they will waste away. They will literally starve to death while eating because without any insulin, their body has no hormonal signal to hold on to that energy.
That really drives the point home. Calories obviously matter, but the hormones, especially insulin, are what tell the body what to do with those calories.
Exactly. So if we want to reverse insulin resistance, we have to look at what spikes insulin the most. And most obvious and potent culprit is carbohydrates.
But what about fat? For, 40 or 50 years, we were all told that fat makes you fat, especially saturated fat. Steak, butter, eggs, all that stuff was the enemy.
And this is where it gets really nuanced, and it's so important to pay attention here. Dr. Bikman's own lab has done research on this. And it's true. If you take saturated fat, specifically a type called palmitate, and you put it on cells in a petri dish, those cells do become insulin resistant.
Okay, so the standard advice seems right then. Saturated fat is bad.
In isolation, in a lab, yes. But, and this is a huge, huge but, that effect completely disappears in living, breathing humans if they're on a low-carb diet.
Wait, hold on. So if you eat butter and steak, but you don't eat them with bread or potatoes, the insulin resistance doesn't happen.
Correct. If insulin is low, your body sees that saturated fat as what it is, fuel. It just burns it for energy. It doesn't accumulate and cause problems. This is why Dr. Bikman calls the combination of high carbs and high saturated fats the unholy alliance.
The unholy alliance. I like that's very dramatic.
Because it is a metabolic disaster. Think of the quintessential modern meal. A burger with a bun and a large side of fries. You have the saturated fat from the meat, and you have the massive carbohydrate load from the refined flour in the bun and the starchy potatoes.
A delicious disaster, yeah.
The carbs spike your insulin through the roof. The insulin then shouts the order to your body. Stop burning fat, start storing everything. So all of that saturated fat you just ate, which could have been used for fuel, now has nowhere to go but into your fat cells, promoting inflammation and that hypertrophy we talked about.
So it's not the fat on its own. And it's not necessarily the carbs on their own. It's when you mix them together in large quantities that you create the perfect storm.
Precisely. The high insulin prevents you from burning the fat you're eating.
Okay, so what about the other big villain in the nutrition world right now? Seed oils. Soybean oil, canola oil, corn oil. Are those part of this unholy alliance?
Bikman is very nuanced here as well. He says that, interestingly, seed oils don't strictly cause insulin resistance in the same direct way that saturated fat can in a lab setting. However, they cause a different and perhaps more insidious problem. They are very prone to oxidation.
They go bad, they break down easily.
They're very unstable fats, and when they oxidize, they create a nasty byproduct called 4-HNE. And this byproduct, this 4-HNE, has been shown to stop fat cells from multiplying.
Whoa, wait a minute. Remember what we said earlier. We want our fat cells to multiply. We want lots of small, healthy cells, hyperplasia.
Exactly. Seed oils, by preventing hyperplasia, effectively force your fat cells down the path of hypertrophy. They force them to expand into that sick balloon state much faster. So while they might not spike your insulin directly, they break your fat storage machinery in a different way.
So what's the simple takeaway from all this?
Avoid bags and boxes with barcodes. Processed foods are almost always the unholy alliance in its purest form. Refined carbohydrates plus industrial seed oils.
Okay, one more food question. What about fruit? Fructose. We're always told that fruit is healthy.
Fructose is very tricky. On one hand, it doesn't spike insulin directly when you eat it.
So it's safe then?
Not quite. It has its own special pathway. It goes straight to the liver. It kind of bypasses the rest of the body's normal sugar regulation. And if you overload the liver with fructose, especially from things like fruit juice or high fructose corn syrup and soda, it gets turned into fat directly in the liver. That's what causes fatty liver disease. And fatty liver is a primary driver of central insulin resistance down the line.
So an apple with its fiber is okay, but a big glass of apple juice is not.
That's a perfect summary. The fiber in the whole fruit slows everything down and protects you. But he does give a warning. If you are already metabolically sick, if you are actively trying to reverse diabetes, you might want to avoid the really high sugar tropical fruits for a while. Things like mango, pineapple, and banana. Stick to berries.
Got it. Okay, let's shift gears a bit. We've talked a lot about the what of eating. Does the when we eat matter? Meal timing, meal frequency?
Ideally, if our metabolism was in perfect shape, we probably wouldn't need to worry so much about timing. But for most of us, it's crucial. Dr. Bikman talks about this great concept of wiggle room.
Wiggle room, I like that. It sounds like how much can I get away with?
That's exactly what it is. How big is your metabolic buffer? And certain things increase your wiggle room. If you have a lot of muscle mass, you have a bigger tank to store glucose, so you have more wiggle room. If you're in a state of ketosis, you're already burning fat for fuel, so you have more wiggle room with carbs.
But for the average person who isn't a bodybuilder or on a strict keto diet?
For the average person, the modern habit of grazing is a metabolic disaster.
Ah, yes, the eat every 2 hours advice.
Yeah.
6 small meals a day to keep the fire burning.
It's terrible advice. It keeps your insulin chronically elevated all day long. Every time you eat even a small snack, you spike insulin. And every single time insulin is up, fat burning stops cold. You are never, ever giving your body a chance to switch over into fat burning mode.
So what is the recommendation then?
Eat distinct meals, 2 or 3 a day.
Yeah.
And the big one, absolutely no snacking between them.
The no snacking rule is tough for a lot of people, especially at night. That evening craving is powerful.
And night is what he calls the dinner danger zone. Dr. Bikman explains that we are naturally most insulin resistant in the evening. Our bodies are winding down and preparing for sleep, not for a big influx of energy.
So that bowl of ice cream you eat at 9 p.m. does way more metabolic damage than the same bowl of ice cream at noon.
Massively more. And it has a devastating effect on your sleep. When you eat late at night, your blood sugar goes up. But it's not just that. Digesting food is an active process. It raises your core body temperature.
And you need to be cool to get good, deep sleep.
You have to drop your body temperature. On top of that, high blood sugar activates the sympathetic nervous system. That's your fight or flight response. So you're lying in bed, you feel a little too hot, your heart is beating a little faster, you feel kind of anxious, and you can't fall asleep. You think it's just stress from your day, but it's actually that late night snack wreaking havoc.
You know, I loved the moment in the discussion where Dr. Bikman got really human and honest about this. He admitted his own personal weakness. He said, and I'm quoting here, "Daddy is a meth addict for cereal."
It was such a great moment of honesty. He said he has to keep cereal out of his house entirely, because if it's there at night, he knows he can't have just one bowl. He'll eat and eat until he feels sick.
It's really comforting to know that even a world-class metabolic scientist struggles with the same late-night munchies we all do.
It really is.
Yeah.
And it proves that it's not just a matter of willpower, it's biology. These hyper-palatable processed foods are designed to hook us.
Okay, so we fix the diet, we stop the snacking, especially at night. What about movement? We talked about building that wiggle room. How do we do that?
With muscle. Muscles are the primary glucose sink in the body. They are responsible for clearing about 80% of the glucose from your blood after you eat a meal.
So simply put, more muscle equals a bigger gas tank for the sugar to go into.
Exactly. He gives a great example. If you have 2 people who weigh the same, say 150 pounds, but one has a lot of muscle and the other has less, their response to food will be totally different. The muscular person can eat a sandwich, and their blood sugar will barely budge and come back to normal very quickly. The person with less muscle will eat the same sandwich and have high blood sugar for hours.
So strength training is basically non-negotiable for long-term metabolic health.
It's critical. He has a great mantra: eat right to be lean, exercise to be strong. But there's also a specific benefit to high-intensity interval training, or HIAT.
That's the really painful stuff, right? Sprinting all out for 30 seconds until you can't breathe.
It's intense, for sure, but that intensity produces a molecule called lactate. And lactate is fascinating. It has the ability to help mobilize glucose transporters in the muscle completely without insulin.
Oh, that is a really cool metabolic hack. So normally you need insulin to come and knock on the muscle's door to let the glucose in. But if you exercise hard enough, lactate basically kicks the door open for you.
That's a perfect analogy. It creates a temporary state of insulin-independent glucose uptake. It's very powerful.
Now, what if you don't want to do sprints? What if you just want to go for a walk after dinner?
That brings us to what he calls the exercise snack.
I think I prefer actual snacks, but please tell me about this one.
It is so simple and so effective. Just take a 10 to 15-minute walk immediately after a meal.
Just a simple walk, no running, no weights.
Just walking. The research shows it can blunt the post-meal glucose spike by up to 50%. Your muscles are gently contracting, and they just start sucking up all that fresh glucose that's entering your bloodstream before it has a chance to build up.
That seems like the single easiest, most actionable takeaway so far. Eat your lunch, go for a 10-minute walk around the block.
It's incredibly powerful for the low amount of effort required.
Now, I want to touch on something that always confused me. You see professional bodybuilders, and they sometimes take insulin to get huge. But we're sitting here saying insulin makes you fat? What's the deal with that? Let's call it the anabolic paradox.
Right. It's a great question. Insulin is indeed an anabolic hormone, which means it builds things up. But Dr. Bikman clarifies that its primary anabolic action in muscle is by stopping breakdown. It's anti-catabolic. It prevents your existing muscle from being broken down for energy.
So it's more of a muscle preservative than a muscle builder.
In a way, yes. And the key takeaway for regular people is that you do not need to spike your insulin with a sugary drink after a workout to build muscle. That's a myth. Protein alone, from something like a steak or a protein shake, is more than sufficient to trigger muscle protein synthesis.
That is very good to know. Okay, we absolutely have to talk about the elephant in the room. Or maybe I should say the shrinking elephant. Ozempic, Wegovy, the whole class of GLP-1 drugs, they are everywhere.
We can't have this conversation and ignore them. They are completely changing the landscape of obesity and diabetes treatment.
Dr. Bikman had a really interesting and, I thought, balanced take on this. First, let's just clarify how they actually work, because I think a lot of people just assume they make your body produce more insulin.
That is a very common myth. He points out that in humans, they do not directly increase insulin release. They work primarily by doing three other things. First, they inhibit a hormone called glucagon.
Glucagon, that's the one that does the opposite of insulin, right?
Yes, glucagon's job is to raise blood sugar. These drugs basically put a gag order on glucagon. Second, and this is a big one, they dramatically slow gastric emptying.
They keep food sitting in your stomach for a lot longer.
Much longer. He mentions it can be up to 20 hours. And third, they work directly on the brain to signal satiety. They just turn off the hunger signals.
Okay, so you're not hungry, your stomach feels full all the time, and your blood sugar isn't rising. On the surface, it sounds like an absolute miracle drug. But Dr. Bikman has some serious concerns.
Very significant concerns. The first one is the quality of the weight being lost. Studies are showing that up to 40% of the weight people lose on these drugs is lean mass. That's muscle and bone.
40%. That is a huge number. If you lose 40% of your metabolic engine, your muscle, you're going to be in big trouble when you eventually come off the drug.
You'll be metabolically weaker than when you started. Then there's the mental health aspect, which is really concerning. He cites studies showing a tripled risk of depression and a doubled risk of suicidal ideation in users.
Wow. Is the theory there that it's because people just lose the joy of eating and socializing around food?
That's a big part of the theory. If you block the reward pathway for food in the brain, you might be unintentionally dampening the reward pathway for life in general. It's a condition called anhedonia, the inability to feel pleasure.
And then there are the more visceral side effects, the Ozempic burps.
Which is really just a polite way of saying you have rotting food in your stomach. Because digestion is slowed down so dramatically, the food can literally start to ferment before it moves on.
That's disgusting. But for all these risks, Dr. Bikman didn't say never use them. He proposed a very different kind of strategy, a microdosing strategy.
This is probably the most fascinating part of the discussion for me. He suggests using very, very low doses. Yeah. Not enough to cause massive weight loss and muscle wasting, but just enough to take the edge off the intense pathological cravings.
So using it as a temporary tool, not as a permanent crutch.
Exactly. He calls it habit rehab. Use a tiny dose for 90 days to break your brain's addiction to junk food. In that 90-day window, you work on building new, healthy habits. Then you cycle off the drug and test yourself. See if the new habits have stuck. It's about treating the drug as a bridge to a better lifestyle, not as the destination itself.
I really, really like that approach. It puts the power back in the patient's hands.
It empowers the patient, yes.
Okay, let's quickly touch on a couple of other hidden factors. We've covered food and exercise pretty well. What about sleep? How important is that?
It is massive.
Yeah.
And the effect is immediate. He says one single night of poor sleep causes acute insulin resistance the very next day.
Just one night.
Just one. It spikes your cortisol levels. And as we said earlier, cortisol is a stress hormone that blocks insulin's effects. It creates a truly vicious cycle. You sleep poorly, so your cortisol is high. That makes you insulin resistant the next day. Your blood sugar stays high after meals. That high blood sugar makes you feel hot and anxious at night, so you sleep poorly again.
It's a feedback loop from hell.
It really is. Sleep has to be a priority.
And what about the environment around us, the air we breathe? This part of his research was shocking to me.
This is some of Dr. Bikman's own lab work. He found that inhaling diesel exhaust particles actually causes fat cells to grow.
Hold on, breathing polluted air makes you fat.
It causes hypertrophy in the fat cells, even if you don't eat a single extra calorie. It's the inflammation from the pollutants that's driving the process. And visceral fat, the really dangerous belly fat, is particularly sensitive to these inflammatory signals.
That is just incredibly unfair. It means you can be doing everything right with your diet and exercise, but if you live next to a busy highway, you are fighting a constant uphill battle.
It really emphasizes that this isn't just about food and willpower. Inflammation from any source is a key driver.
All right, we have covered the problem, the mechanism, and all the hidden traps. Let's bring it home and talk solutions. Dr. Bikman laid out a very clear path to reversal. How fast can someone actually turn this ship around?
Very fast. He mentioned a case study where patients were able to completely reverse their type 2 diabetes numbers. They dropped their A1C from a very dangerous 8.9 down to a healthy 5.6 inches, just 90 days.
3 months. 3 months to fix a disease that we're told is chronic and progressive. That is so hopeful.
And they did it without any drugs. They just followed what he calls the 4 pillars.
Okay, let's listen for everyone. Pillar number 1.
Control carbs. This doesn't mean you have to go full zero-carb keto, but you need to focus on whole, unprocessed, low-glycemic fruits and vegetables. And you have to avoid the white foods: sugar, flour, bread, pasta, rice.
Simple enough. Pillar number 2.
Prioritize protein. This is huge. He recommends aiming for 1 gram of protein per pound of your ideal body weight. It keeps you full, it prevents muscle loss, and it helps build that crucial muscle sink for glucose.
Okay, protein first. Pillar number 3.
Don't fear fat. Eat the healthy fat that comes naturally with your protein. The fat on the steak, the yolk in the egg, the skin on the chicken. But, and this is a very important distinction, don't go out of your way to add unlimited extra fats. Don't put a stick of butter in your coffee if your main goal is to lose your own body fat.
Let your body use its own stored fat for fuel instead. Makes sense. And the final pillar, number 4.
Intermittent fasting, or at least time-restricted eating. The simplest rule is to just stop eating 3 to 4 hours before you go to bed. Condense your eating window. Give your insulin levels a break for a significant portion of the day.
And what about supplements? Is that all just snake oil, or are there any that he thinks actually help?
He's not a huge supplement guy, but he likes 2. First is berberine, which has a lot of solid scientific evidence showing it can help with glucose control almost as much as some pharmaceuticals. And the second is good old apple cider vinegar.
The vinegar trick, how exactly do you use that?
You take about a tablespoon in a glass of water right before you eat a meal. The acetic acid in the vinegar does 2 things.
Yeah.
It inhibits your liver from dumping out too much sugar, and it helps your muscles take up sugar more efficiently. It's a very cheap, very effective little hack.
Okay, so this has been a ton of incredible information. If the listener is going to take away just one thing from this entire deep dive, one action to start today, what is the one thing Dr. Bikman recommends above all else?
Change your breakfast.
Just breakfast, that's it.
He says it is the single most critical step. You have 2 good options. Either fast through breakfast and just have coffee or tea, or if you're going to eat, you must eat a high-protein, high-fat breakfast. We're talking eggs, bacon, sausage, avocado. Never, ever start your day with a big glucose spike. No cereal, no toast, no bagels, no orange juice.
Because if you start your day with that sugar spike, you're on a blood sugar roller coaster for the rest of the day.
Exactly. You're chasing that high all day long. If you can just keep your insulin low and stable in the morning, you've already won half the battle for the entire day.
This has been so eye-opening. It really changes the way you look at health. It's not just about calories in, calories out. It's about information. It's about hormones.
It really is.
Yeah.
And it empowers you to take control. You are not just a victim of your genetics. You are the manager of your own insulin.
So here's my final provocative thought for you listening at home. When was the last time you had your blood work done? And did you look at the results? Did they even check your insulin, or did they only check your glucose?
Because you might have been told you're perfectly healthy on paper, but you could be fighting a raging metabolic war just underneath the surface.
So go look in the mirror. Check your neck for those dark patches, check for those skin tags, and just try the savory breakfast challenge for 1 week. Ditch the cereal and have some eggs instead. See how you feel.
It might just change your life.
Thanks for diving deep with us. We'll see you next time.